I had a bit of a curveball question for you because I've been studying this lately and I've actually added it into Mum's
Well,
protocol.
let me before you go there, one of the things you said before about the 36 holes in the roof,
Hmm.
I have a chart showing all 36 holes in the roof plus all the others in the literature that
Yep.
contribute to the height. So what I then did was put another column next to that and showed the citations in the peer-reviewed literature for how photobiomodulation addresses all of them
Cool.
but two.
Yep. Wow. And so the 36, there's a lot and I've gone through that list and I've been, oh, wow, it does that and it does this and it does this as well. And, all the interleukins that it down regulates and TGF betas and goodness knows whatever it does are all covered by photobiomodulation. So this is
All,
really
all but
exciting. All
all
but
but
two.
one or two, right? All
Yeah.
but two.
Yeah.
And there's now a compound that's being marketed in the US that we're going to start looking at. It's called Nurella, and it contains
Mm.
many of the compounds that the ReCODE protocol is promoting.
Wow.
So instead of having to take lots and lots of things, you might be able to take just two of something twice a day. So we're looking into that now.
Oh, share if you don't mind that
I will. No, once
info.
we get some data, yeah, once we get
Yeah.
some data, I'll be happy to share. Yeah, absolutely. Yeah, it was developed by a colleague of mine, Dr. John Fellis. He's a
Wow.
neurologist here in New Jersey. Yeah, it's a very interesting compound. This probably won't be the last time we ever talk.
No, this definitely won't be. Well, I need your help with Mum for starters. um, but
Happy
it
to help.
also for other people. But this I had a curveball for you. So
Sure.
recently, Mum's been having recurrent UTIs, and so this put something called methylene blue on my radar, and I've
Yep.
then came across the work of Dr. Francisco Gonzalez Lima.
Gonzalez Lima. He was the
Yeah.
other person who was studying 1064.
Oh,
It
yes, of
was it
course he
was
is.
it
Of
was
course he is.
Francisco and me. That was it.
Wow, I want to.
Until
I need an
yeah,
intro because I need him on the show. So methylene blue, can we do that? Yeah,
sure.
because I've been trying to reach out to him, but um,
He's yeah,
methylene
he's
blue is that? Yeah, well, tell
it's
me a little
certainly
bit about.
something to include. It's certainly something to include. And don't go to the fish tank store and
No,
get
no,
it.
no,
No.
USP
No, don't do
only.
that.
No, but I've seen in the last 2 weeks since I've had Mum on methylene blue, or 3 weeks now, she has gone because we had this terrible UTI and the broken hip and
Sure.
operations and so on.
Sure.
And so we lost her, and since I put the methylene blue in, and I've continued the red light,
Yep.
she's now like fully back to where we were baseline,
Right.
which I'm
Yep.
stoked about because I lost my mum again, right? I lost her, and then we've brought her back again, and she's now reading to her grandchildren and can
It's
read,
wonderful.
like
Yeah. Yeah.
it's wonderful. And so I'm excited about methylene blue, and that's sort of working in a similar way, going to the cytochrome C oxidase, bypassing that electron transport chain issues, as well as working
That's
on
right.
the red blood cell and oxygenation and so on. Um,
Right.
so so you start piling these things on top of each other in this,
Preferably with some degree of understanding about what comes before what and how much.
yes,
And I mean,
yep,
that's where we're just at the very beginnings of
yeah,
understanding, is 810, for instance, is
yes,
810 significantly better at enhancing cell viability
uh-huh,
and survival, whereas 1070 is better at promoting neurogenesis and synaptogenesis. Is
uh-huh,
that really true?
yeah,
There's evidence that shows that that might be the case. Well,
right,
okay, then why not make the helmet
with
have both
both,
wavelengths in it
yeah,
and have an intelligent AI methodology that allows you to modulate which wavelength is going to be most useful at what time, at what spot, for how long.
yeah. This is
That's
what you're
that's what
aiming
we're
for, isn't it? In your
that's what
next
we're
part of
doing.
your is to get the
Yep.
EEG inside the helmet and give it in real
Yep.
time so that you'll be able the device will actually be able to work out, oh, their brainwave frequency on this side is not doing what it
Right.
should be. So we'll put more over here and we'll do less here. And in real time. That's going to
That's
be
it.
game changing.
That's it.
But currently, if people can't get the EEG and they buy a neuronic or the new radiant
Yeah, they can come to us.
1070, and
Yeah,
they
can
can
come to
still
us.
use it, like because with the Baylor Scott
With consultation.
with consultation. Yeah, so you could do it without the EEG with consultation. Yeah,
Sure.
if we
Oh yeah,
can't
I
get
mean,
this.
I would highly recommend people get a QEEG if at all possible.
Yep,
And
if at all
we
possible.
can work on getting more people to do that. We can get more people to do it. It's just an incentive, figuring out the right incentive and getting them to use it.
Yeah, yeah. So
Because
and
it's
you're
not
putting
expensive to do.
yeah, once you've got the device and
It's not
and
that
from a
expensive.
clinician, like if there, because there's lots of doctors and clinicians who listen to my show, if there are doctors
Great.
and clinicians that want to include this in their practice,
I would be,
how
I mean, that's what Quiet Mind, that's the foundation's, part of the foundation's mission is to enhance clinical education and transfer these technologies and transfer this knowledge into practice. So
wonderful.
we're consulting with lots of different practices who are integrating photobiomodulation and or neurofeedback into what they're doing. And we're doing outcome analysis and showing that when you combine these two things, you get better results than if you don't.
Yeah,
If you include these kind of technologies with medication in psychotherapy and psychiatric clinics, if you include these technologies, you get better outcomes, clinical
yep,
outcomes.
yep, yep. And with
Okay.
functional medicine as well, if you add into that some really good testing to see, heavy metals, omega-3
Well,
index,
yeah,
organic acids,
well,
all of
Neuronic,
that.
I mean, yeah, the Neuradian is an affiliate with Dr. Bredesen. So
Yes,
the
yep.
Neuronic is an affiliate, and Quiet Mind is also an affiliate with the Apollo Health, which is Dr. Bredesen's group. So people who are doing the ReCODE coaching can acquire at a discount. They can acquire the Neuronic technology, and
Mm-hmm.
I'm providing the Radiant technology directly through Quiet Mind. It's not going to be it's not going to be a big benefit for people outside the U.S., but anybody in the U.S., we can provide a 501, because we're a 501c3 nonprofit, so people can donate the cost of the technology,
Mm-hmm.
right? And we can send them a donation letter less the cost of the device.
Wow.
So people can write off the cost of a significant portion of the device and the consultation simply by doing it as a donation to the Quiet Mind Foundation Research Fund.
Wow. So that's for people that are in the States listening. You could do that. And yeah, we'll talk off air on what we can do to work
Sure.
together down here. But let's go back into the science.
Okay.
So the next generation is going to have EEG in the New Radiant, perhaps because like the one that I've got from Dr. Lou Lim, who you've also had on the show, people, if you want to go and look up those podcasts, I've had him
Absolutely.
and Peter Adams on, um, and that's an 810. So the 1070 would be better for someone dealing with sort of major cognitive issues based on the current state of research. For traumatic
Yes.
brain injuries, maybe
Yes.
rescuing with the 810. Yeah, because
Maybe.
there's so
Maybe.
many nuances to this whole red light. When I started looking into the so many, even for just
Oh yeah.
general health and skin health and all of that sort of thing, and collagen
Right.
production and blah, you've got the nanometer wavelength, you've got the power output, you've got the fluence, you've got the, what do you call that synchronicity thing? Forgotten the correct term.
Coherence.
Coherence, thank you. So there's an awful
Oh
lot
yeah.
to the science, and there's so many applications. So there's so many science research that needs to be done
Absolutely. Absolutely.
with
It's a very,
dosing and
very,
all of
very
that.
important.
Yeah,
We're just getting started. We're really just
yeah,
getting started.
yeah.
Yeah.
And then
And
when you get you listen to, but a lot of people would go light. I'm not a plant. How would I be receiving light except through my eyes, which people get? But that's not true.
Your skin is a photoacceptor.
It's a
Every
photoacceptor, and we
every
have
every inch of
chromophores.
every inch of your skin, every inch of our skin reacts to light.
Yeah. And so when we
So,
don't get, like, just going back a little bit, when we don't get enough sunlight, like for
oh yeah,
people that are living inside on screens that are emitting blue light all day, I just did a episode on that. That's problematic. Just from a general health point of view, get out
yep,
in the
yep.
sunshine, see
Oh,
the early
absolutely.
morning light, circadian rhythms, all of that sort of jazz.
That's very important. I mean, I work with the people I work with. One of the most important things is get outside between dawn and 10:30 in the morning and get the sunlight on your face so that your brain produces the melatonin that you need that night in order to sleep right.
Yep. And gets that
And it's
cortisol up in the morning, and
but that
yeah.
10 dawn to 10:30, Jack Kruse's leptin hypothesis. I mean,
Yeah.
knowing that that's that's what you got to do. And we were designed to do that for a couple of 100,000 years.
Yep.
And then that Nudnik Edison came along and
Buggered up our circadian rhythms and made us, and
what are you going to do?
we did need it, but and then the whole incandescent light that we used to have that had more
Yep,
of the red spectrum in it, and
yep,
now we've got these terrible LEDs that are really just the wrong light for us.
yep.
So minimizing our exposure to the junk light.
Well, that's why
You know,
that's why I'm using the OT light. I use the OT light on my desk to get the full range fluorescent at least.
exactly, and
Just
get outside.
yeah,
Like there's I've forgotten who it was, but somebody did a study where they took COVID patients out of the hospital for 15 minutes a day and got sunlight exposure onto their skin, and proved that that actually decreased the
yep.
days of hospital and their severity of the COVID, and so on. And then vitamin D, where was all that conversation during the whole none of it. um and there's some pretty basic stuff, and we are evolutionary animals. Like, we need to, I think, respect where we came from
Oh,
and
absolutely.
developed.
Absolutely. You
Yeah.
you would love having Sarah. You should definitely
Oh
try to
yes,
get Sarah
please.
Turner.
Well, maybe
Yeah,
you can give
because
me an intro.
she loves all this stuff and she's extremely well versed in it. Yeah,
Yeah,
she'll be a great guest. She'll be a
I
great
think,
guest.
because I think so many people are suffering from depression and mood disorders and things
Sure.
purely because of the wrong exposure and not enough the right exposure to sun. And then we're
Right.
all told to never go in the sun because it wrinkles you and causes damage. And cover yourself in sunscreen and cover yourself up the whole day. And it's just rubbish. It's putting
Everything in moderation, right?
Yeah, midday sun, UV, maybe not right bang smack in the middle of the day, but yeah, if you listen to Dr. Jack Kruse, yeah, he's interesting. He's got some interesting things, hasn't
Yes, he does. Yes, he
he?
does.
Marvin, you've
Ah,
been absolutely wonderful today. I'd like to thank you so much for the passion you bring to the work, the
happy.
mission that you're on to help millions and millions of people worldwide from now
Yeah.
moving into the future, because it's just absolutely crucial. And I want to get more of the word out there that there are things that we can do to fight
Oh,
dementia and
absolutely.
Alzheimer's, Parkinson's, all of that traumatic brain injury. And this is where
And
we can start.
let alone prevention.
Oh gosh. And
I
that's
mean,
so simple
we've
at
already
that point.
shown, yeah, we've already shown that this type of intervention is preventative because we've shown that normal people who use the same protocol as we used with the people with dementia improve about the same amount on their functioning as the people with dementia improved on theirs. So it's already been published that
Yeah.
this really works and therefore can be spoken about as being preventative.
Yeah. And Alzheimer's does not pop up out of the blue. And as Dr.
No,
Dale
no,
says, it's like 10, 15 years in the making before you get even the mildest symptoms. So if we understand that, then we can do so
right.
much to prevent that: diet, exercise, all of that as well.
Oh yeah. And
Just,
I mean, if you take a picture of your retina with,
mm,
for $50, you can take a picture of your retina at the where you put your chin on it in the little blue
hmm
circle.
hmm
Right. You take that picture there, you can measure the amount of amyloid deposition on the
Wow.
retinal tissue.
Wow.
And you can predict the onset of dementia 15 years ahead of any kind of symptoms, just from the picture on your retina.
Why is not
I mean,
every eye doctor telling us this?
because every eye doctor doesn't know that because they didn't study with Dr. Tremp at Harvard.
Mm.
But Tom Lewis, Dr. Lewis, who runs something called realhealthclinics.com, Tom Lewis knows that because he studied with Dr. Tremp. And I'm friends with Tom Lewis.
Right. Well, I've just
Yep.
put,
And Tom's been working with people on this level for years and years and years. And
wow.
we work with Tom. We work with Anil Bajnath, who's our functional medicine functional medicine longevity expert. And Anil knows this stuff extremely well and has a clinic in Maryland near Annapolis, the naval base. He's
Mhm.
down there near Washington, D.C. And he's doing an advanced level program for people on increasing their longevity and making sure that they stay as healthy as possible,
Wow.
optimizing their health across all the parameters. Yeah, I mean, there are people doing very serious work, and we're thrilled. I'm thrilled to know them and be able to work with them closely.
And I need some introductions. We'll get them on the show and start sharing this.
Happy
Because
to.
I
Oh yeah,
wasn't
no,
aware of that one. I wasn't
yeah,
aware that we could just, get a
yeah.
retinal, and hopefully we can do.
Correct. I mean, you could do that. That's there before the QEEG is needed.
Go
You
and do
know, you
that
can
and
go
see
get
that.
that. You can do that and know 15 years ahead
Wow.
what you need to be doing.
Especially for people with ApoE4, or familial,
Absolutely.
genetic
Absolutely.
things, that would be a
Right.
really good thing to do. So I have to ask, I'm going
Oh
to
yeah.
go and see the optometrist here and see if they do that and see if they can do that.
And
If they don't,
if they don't, they could.
yeah, and put it on their radar. You never know. Dr. Marvin, thank you so much for your time today. You're a wonderful human being. Thank you so much for all the work you do. And this
Great
won't
to
be the
be here.
time we'll be talking.
Take care.